Hi, I'm Dr. Rita Kathawa, bariatric medicine specialist and founder of Michigan Weight Loss Institute.
And I'm Dr. Marissa Baca, a board-certified plastic surgeon at the Straith Clinic. And this is A New You by Us Too.
And we're here today to continue our discussion of weight loss treatment and body contouring after weight loss.
And then today we're going to focus on what happens after you've had body contouring surgery. What are the ways to kind of ease through the post-operative recovery and to maintain your results?
So get us started, Dr. Baca. What are we dealing with in terms of recovery and recovery time?
Yes. So I think probably the most common question that I get from patients is, when can I go back to work? Because that kind of frames when can they have the surgery, and that everything sort of builds off of that. So a lot of it depends on whether you have a desk type job so that you're not doing a lot of strenuous physical activity, or whether you are more active in your job. Like a lot of my healthcare workers are, lifting, they're assisting with patients, they're turning, they're lifting equipment. And so that kind of becomes two different categories of things. So for most patients, after body contouring surgery, you're going to feel pretty sore, pretty unlike yourself for the first couple weeks. I would say it takes about a month to really start to feel like you are yourself again. And a lot of my activity restrictions center around the first 3 weeks. So that's when I'm the most strict, no heavy lifting, no strenuous activity that's increasing heart rate or blood pressure. If you have a desk job or you can work from home, maybe after that first or second week, you're able to log on and kind of do some stuff because you're not doing any of that heavy lifting. If you are one of my healthcare providers, maybe we're talking more 4 to 6 weeks before you're back, depending on if you can go back with restrictions and whatnot. So the recovery timeline, a lot has to do with where you are with physical activity. Then maybe swelling is coming down a lot in that first month, but little bits of swelling are hanging around even till about 3 to 6 months or so. So we're not really seeing that full impact of that contoured shape until those 3 to 6 months. We're seeing some improvements, right after surgery, and then week by week as the swelling goes down, but it's really not till that 3 to 6 month time frame that we're seeing that final result in that contour.
And you mentioned soreness after surgery. You do provide some medications, maybe a short course of pain medicine or nausea medicine or something to get the patient through that phase as well?
Yeah, definitely. There's usually some prescription pain medication that many patients use for a short period of time right after surgery. But then a lot of times we talk about other ways to kind of help with pain, where heat and ice can come into play. But sometimes with surgery, there are certain areas I don't want you to ice because I don't want to risk the blood supply. But oftentimes, for example, after a tummy tuck, people have a little bit of that bent over posture. And what that ends up translating to is a little bit of low back pain because our bodies aren't used to walking around with a little bit of a hunch. And so sometimes a heating pad on your lower back can be really helpful when applied in the proper way. So kind of looking at some other modalities other than just some of the pain medication to get you through can be helpful. And then there is also a role for lymphatic massage in certain patients and certain procedures, sometimes by helping to kind of massage away or encourage that swelling to go back to the lymphatic basins where they're from so that it can be absorbed. That swelling fluid has a lot of those inflammatory markers that cause us our discomfort and our pain. So sometimes that can be helpful to bring patients back so that they're feeling a little bit more like themselves.
Certainly. And then compression garments can sometimes help with swelling, but also probably discomfort too from just keeping everything in place.
For sure.
Wouldn't you say?
For sure. Patients have a love-hate relationship with their compression garments. They are super helpful. They are very helpful in body contouring surgery. In the beginning, I tell patients you're climbing into them, and I truly mean that. You are like climbing into some of these more complicated compression garments. And so that is a bit of a hassle. But once on, patients usually feel really supported in their garment, and it's doing some important job for us by trying to reduce the amount of swelling that a patient develops and also help the swelling that develops go down a little bit quicker and also in kind of the right ways too. So compression garments are very helpful. I'm usually keeping my patients in compression garments full time for at least the first month, depending on their surgery, but and then we kind of wean after that depending on how their recovery is going.
We have a lot of patients that travel from out of town to see us. So for those patients that do have surgery, when should they plan to return for their post-op visit?
Yes, excellent question. I usually like out-of-town patients to try to stay in town at least till their first post-op visit. For in most patients, that's at about 1 week. That's when a lot of kind of the initial checks are happening and whatnot. And then from there, depending on how far away they are, sometimes a 1 month visit can be done virtually. And so sometimes maybe I want to check base with them in person again in a couple months. But then an important discussion is the safety of the travel after surgery. You know, do you need to get in a car? Do you need to get on a plane? How long? And then making sure that we can talk about some safety management for some of those things to prevent things that can be serious, like blood clots and things like that that sometimes occur, the risk can be increased with travel.
And when it comes to mobility after surgery, you're right. I mean, the benefits, we can't emphasize it enough, at least walking to minimize that
Definitely.
risk to get a blood clot. But you did mention to stay away from heavy lifting.
It's finding the right balance because some of my patients are doers. They are busy people. They find it really difficult to kind of sit down. And so on one hand, it's good to keep a little bit of mobility, but we don't want to overdo it. Exactly. And then on the other hand, some patients feel really, really sore after some of these procedures and kind of want to just lay in bed and not move at all. But again, then we do want some walking. We want to keep that blood pumping and flowing through the legs to try to minimize the risk of blood clot. And I think that also just helps people get back to normal a little quicker, still doing kind of light things around the house, still walking around a little bit and making them increase that transition back to feeling like themselves again.
Yeah, thank you for walking us through that. I mean, sometimes it's good to know what you're getting yourself into, not just surgery and risk, but also afterwards. You know, how much activity am I going to be able to do? Can I take care of my kids? When can I go back to work? When do I have to come back into town? So all that is super good to know.
And planning it around your lifestyle is so important. You know, some people, let's say they're golfers, and, you know, here in Michigan, at least, there is a defined amount of time that you can be playing golf. So maybe you don't want to have your surgery right before then if that's going to kind of take you out from something that you love. So kind of planning where your activity limits and your restrictions kind of fit into your life, I think is so important.
And when it comes to sun exposure and scars,
definitely.
We can't.
Yes.
Yeah, I feel like we should touch base about that a little bit.
No sun exposure, 100%. So yeah, there are many things that you can do to help with scars. Some of it starts with your genetics, so that can't be changed. Some of it has to do with our surgical technique, and then a lot of it has to do with the aftercare. So usually we're recommending things like silicone scar tape, maybe scar massage, and then sun exposure is one of the number one things that if we can avoid that, that's only going to help with scars, because excess sun exposure, especially in the first year while a scar is forming, can cause some permanent darkening to the scars. So 100%.
Sunscreen. Don't forget your sunscreen. In terms of transitioning back to exercise to maintain your weight. Now that we have contoured, we need to think about how we're going to be able to maintain our beautiful results. So
definitely,
maybe walk us into exercise after that.
Yeah, definitely. Well, and because so many patients have worked so hard to get to this spot, and so it does scare them a little bit. Okay, I can't go to the gym or I can't exercise for X amount of time after. Well, that, you know, pulls me out of my routine. So we want you to do it, to get back into it in a safe way. And In the beginning, when you feel able, a light walk is fine. Again, we don't want to increase heart rate or blood pressure. We don't want to be walking outside when it's icy like the Michigan winters and we think we might trip and fall. But a little walk, if that, gives you that sense of movement and clarity, great. And then as we move out of those activity restrictions and we can get back into exercise, I find low impact cardio to be a good place to start. So things like a stationary bike or an elliptical help get some of that movement, but without some of the, pound on your body that maybe jogging or some of the other like cardio classes and things like that can have. And then, working with weights, light weights, starting slow and working up to your previous ability is so key, because either way you will have been on a pause for a couple weeks around the time of your surgery. And so it's just like, even if you hadn't had surgery and you stopped exercising, you stopped working out, you stopped running for a period of time, when you got back into it, your endurance would be down a little bit. So you have to keep that in mind after surgery too, and start slow and kind of build up for what your body tells you that you're able to do.
Certainly. And at Michigan Weight Loss Institute, we do have access to exercise personnel and coaches that, if needed, we can set up a referral to work closely with the patient to avoid injury and 100%. Get you back into where you need to be to maintain your goal.
And it gets back to that, reaching out for help. You kind of don't know exactly how your body is moving and changing after surgery. So reach out to someone, a trainer, someone who works with post-surgical patients and can say, okay, we're going to do this because it's going to help you get some of that movement in, but it's going to be offloading the areas that are still recovering. And so I think that's great.
When it comes to maintaining your results long term, we've talked about weight loss, and then we talked about contouring afterwards, and the importance of maintaining the results afterwards is really just as important as getting there.
Definitely.
Not to scare anyone, but we've seen some cases where there is regain.
Definitely. And I would say after your surgery, now is not the time to say, okay, I'm done with my weight loss specialist. We're all good now. If anything, that's one of the key times to stay with your team, stay with the people who have helped bring you to this point in your weight loss so that you can maintain and stay in a good groove of healthy habits.
Exactly. We've seen cases where once the excess skin is removed and a patient regains, that area becomes a little tight and uncomfortable. So we want to minimize that as much as possible. At the same time, the follow-up burden does decrease for maintenance. So, we're not checking in, every 1 to 2 months, maybe a couple times a year, just to make sure we're where we need to be. And if there are any issues, we can troubleshoot them early rather than wait where the area is too tight and we're having pain. And
Right. Early intervention is always so key. And having someone that keeps you accountable, I think, is helpful for so many people. Stay with your team, keep accountable so that you use your new body, your new contour kind of as your motivation to keep you going.
Definitely.
Alrighty, well, I hope you all enjoyed hearing a little bit more about the aftercare after your body contouring. And as always, you can look at our social media and our website for more episodes and past episodes, and shoot us a message if you have any questions. Thank you.